The Ontario government has expanded the RSV Prevention Program to include everyone 75 years and older, helping to protect those most vulnerable during the upcoming respiratory illness season. To tell us why this is important, we're pleased to welcome Dr. Zain Chagla, the Co-Medical Director of Infection Control at St. Joseph's Healthcare, Hamilton. Dr. Chagla, good morning.
Hi, good morning. Thanks for having me.
Let's start with the basics. What is RSV and what are the signs and symptoms?
So RSV is respiratory syncytial virus. And so this is one of the common viruses that spreads during our respiratory season. It's probably the third most common reason and people end up in hospital for respiratory illness outside of COVID and influenza. And, I think we think of it as a childhood disease, and we saw a couple of years ago after the pandemic, our ICUs being filled with it in pediatrics. But the reality is it's also an adult disease. So we see a significant number of hospitalizations, again, the third most of all the viral infections for adults over the age of 65 during respiratory season.
So tell us about the new Ontario expanded RSV prevention program and how it's going to work.
So there are two licensed COVID vaccines that are, RSV vaccines available on the market, and they have been available for the last 2 years. The Ontario government has taken the step of funding the vaccine for those 75 and older, which are, again, one of the highest risk groups to be hospitalized for RSV. This is really important. We do a lot to make sure those populations are vaccinated against COVID, influenza, pneumonia, shingles. And so adding another piece to that bundle of protection really helps prevent those vulnerable individuals ending up hospitalized with RSV. And we know that viral infections also increase the risk of things like heart attacks, strokes, make emphysema worse for those at risk with lung disease. And so really trying to create that bundle of protection otherwise.
Why are older adults at risk of severe RSV? Is it because their immune system isn't as robust as someone who's younger?
Yeah, I mean, there's a number of reasons. One, again, as you said, their immune systems start becoming a little bit worse than those who are younger. Number two, they accumulate comorbidities. That's a part of age, and unfortunately, those comorbidities put them at greater risk. And number three, older individuals become a bit more frail with age, and so bouncing back from that severe respiratory infection, what a 40-year-old would be able to do, may not be possible for that 70 or 80-year-old. And again, their underlying medical conditions may actually get worse after that viral infection.
And what are you seeing right now in clinic in regards to RSV risks and clinical care?
So I think, it's still a new vaccine. People are still, not totally aware that RSV is one of those things that affects individuals. I think people, when we talk about the fact that RSV is, just as bad as influenza in terms of what it can do for people, that it can worsen heart disease in certain individuals, and that there is an effective and safe vaccine on the market, there's a lot more engagement. So, for all of you out there, it's a great time to talk to your pharmacist, to your provider, to really understand that there is another level of prevention for those over the age of 75 and realistically those over the age of 60 where it's still accessible.
How do you know you have RSV? Is there a test like COVID, and what should you do if you do have RSV?
Yeah, no, it's a great question. Unfortunately, in the community, we don't test for RSV. It's one of the milieu of viruses we see along with COVID and influenza. They're very hard to distinguish clinically and in fact, almost impossible. RSV does cause a lot more wheezing and coughing, but those can be seen with influenza, with COVID, with the typical common cold and other things that circulate in the season. So, same advice as everything. Stay home while one's sick, wear a mask when you're going out in public. If you have to go in public, good hand hygiene. Don't visit people who are vulnerable otherwise. But, again, and in most individuals, this is one of the illnesses that affects them during the season.
We have just under a minute. Is it safe to receive the RSV, COVID, and flu shots all at the same time?
Yeah, absolutely. So we have now 2-3 years of good data on this. We have clinical trial data on this, that these vaccines can be given simultaneously. It's the proper time to do it. Obviously, influenza and RSV co-circulate during the season, so you want to make sure that you're started for protection for both. So, absolutely, pharmacists, physicians' offices can administer all at the same time.
Dr. Chagla, thank you so much for your time this morning, and good luck treating those during this respiratory illness season.
Thanks so much for having me.
That is Dr. Zain Chagla from St. Joseph's Healthcare, Hamilton.